iterated already about how alcohol is a factor if you're sleeping with your child, and you can roll over on them and not know it. Cited reasons for parental noncompliance in risk reduction strategies. And again, too, this is actually in your handout, and it is all over the CDC website, countering their common reasons for noncompliance. So the fear of aspiration or choking, their concern for the overall safety of their infant might be one of the reasons that they cite. They feel like a lot of times looking at their infant on their back, that the infant looks uncomfortable. They just kind of are laying there, is one of the other reasons. Perceptions that babies sleep better on their sides than their stomachs, just from being raised probably by a parent that had that practice of doing that. Recommendations of others. How many think this is a big deal? Who do they get recommendations from? Parents. Aunt, uncle, parents. And can they be strong-willed? Oh, absolutely. Absolutely. Aunts, uncles, all of those. Modeling of risk reduction techniques during every encounter speaks louder than words. Dr. McClain had mentioned that modeling of practices, people do look to medical professionals for advice, and if they see you doing it in the hospital, they are more likely to do it in their home environment. Messages need to be clear, simple, and delivered at the level that your parent can understand. How many people know what level we should be delivering some of these messages at? 3rd grade, 4th grade, 5th grade. You just really need to know your parents to know where to kind of go with that. Use of sleeping literature pamphlets, and again, that's a consistent message. It is something that is put out by the CDC. It is what we're going to be using. Scripted messages, again, promote consistency. Address issues directly with accurate science-based statements during every patient encounter to reduce the risk. And again, too, in our handouts, some of y'all do have the booklets. Most of them are gone. It is there. It tells you what you can tell them when they have questions that you can answer. And if you don't know the answer, you just say, I will get back with you on that. And maybe go seek some expert advice from somebody or go to one of the websites. And we don't expect you to know all the answers. A little blown out there, but this is a Safe Sleep poster in English and Spanish. We have that available to us to use. Any questions? We want to carry this message, you to carry this message and to deliver it to whomever will listen. Helen Keller made the statement, alone we can do so little, together we can do so much. So we will entertain any questions from y'all at this point.
I'm Trish Horlocker. I'm the director of the Mother-Baby Unit. We are very excited to implement our Safe Sleep SAC initiation, which would start on Mother-Baby and in NICU April 1st. A sleep sack is what you see pictured here. It's the armholes and it just zips up. The baby just fits in it so there's no blankets. What we'll be using in the NICU and on Mother-Baby is very similar to that, except it'll have the swaddle part too. But the swaddle is down here. It's not like you see the babies now where they're swaddled and it's all up around their faces. So it's a much safe sleep environment.
Thank you so much for coming out. I really do appreciate it. I think this is a great thing.
I want to recognize Cathy. Let's give her a big hand. She's put a lot of work and effort into this. It's a group effort.